So we are here, Oradell at the Oak House. All right, Oradell, New Jersey, therapy without a degree. You guys know Joe Fucarino. I think this is like chapter episode like 305, 302, 300. Well, it's a lot of episodes. This is your second episode.
Yes, second episode. I mean, it's the only fun one.
Right, that's only Matt. So I'm gonna need you to look real close.
Okay.
They got to hear everything you say.
Okay.
All right.
It's episode 2. It's the only fun one.
It's the second one with Tenafly and Ordadell Dental Associates. Like you said, it's the only one that counts?
Yes.
All right. So.
Although I like all your podcasts.
Thank you. We have Jen here in the restaurant, chilling.
Always excited to be in the house.
Just check an angle for a second.
Excited to do therapy.
Are we good? Dr. G, are you as conceited as I am? We might need to check.
I'm sorry?
I'm always excited as I eat my own.
I feel like that's straight
do
on.
therapy without a degree.
Yes.
Okay? Because
Exactly.
a degree means nothing to me. Personally, real people mean something.
100%. And then we got Dr. G in the building.
Thank you. Good to be here.
Yes.
Thank you for coming.
And then if you guys haven't met her yet, she's here, Simone. No, we're not changing the angle. You look great. This is a vibe. I heard you. Yep. But we are here. All right. Since they don't know you yet, right? Because this is your first time on the show. Last time you were behind the scenes.
I was.
Right? You're our audience.
But she's like very much involved in the scenes.
Yeah. So I want you to tell us about what do you do at the office.
Okay, so I'm basically Dr. Gamza's consultant on Botox. I do the consults. I'm like the patient advocate, right?
Yeah.
And when people come in, I tell them my opinion on what I think they need and what I think would be best for them, that they'd leave our office happy, which is really our number one goal.
She also makes the patient feel very, very comfortable. Patients that are coming in for like Botox and lip filler consults, Simone makes them feel very at ease, very comfortable, and she's a very big expert in the field. So
yes,
yeah.
Thank you.
Honestly, I will chime in on one part on Simone's behalf because that's what I do. I chime in. It's part of the managerial position. But I will say this. Everybody in our practice has a wheelhouse. Everybody has a niche skill set. Everybody we bring in knows their stuff. Simone's strictly Botox. She's been doing it for years. She knows exactly what to do. She doesn't drop eyebrows. She doesn't make you look like you're botched. The girl is straight on point, okay?
I know nothing about dental.
We brought
all
in the
Botox.
best, okay? Now,
Awesome.
Dr. Gamza, we already know he's the best. But why he's the best is he knows where to put people strategically and where they're going to flourish. And he puts everybody in the best possible spot where they will grow and add more to the business. And that's why we don't get sick of each other.
Yeah. Let's go.
Very well put.
So I want to know.
That's the brain power right there. Yeah.
So Dr. G, why did you want to bring this into your practice? Like, what was some of those that motivation to now offer this?
Well, actually, I have a lot of patients that have TMJ issues, grinding issues, headache issues. And at first I was thinking, how am I going to help these patients? And I thought, a night guard was a good way to help them, but Botox is an excellent way to help alleviate their TMJ pain. And once I started exploring Botox, then I thought this is a good idea to help people with their wrinkles, with making themselves feel younger and more youthful. And I feel like that it's a really good good adjunct to add to our office.
Plus, he's a master at lips. I've never seen somebody do lip
Thank
filler
you.
like Dr. Gam said. I really don't just say that.
Thank you.
I actually have let my own dissolve, and I haven't touched my lips for probably, I think, 8 months since I've been with you guys. I haven't touched my lips because I'm waiting for it to all go so Dr. Gamza could do mine. He's excellent. He just has such an eye for it. I don't have to say a word while he's doing lips. He has a complete eye for it.
Thank you.
And
Don't forget our lip special that's coming up.
oh yeah,
Be a
oh
part of.
guys, so we have a lip filler special, which is so cheap. I don't know exactly what it is. It's ridiculous. We're doing it.
I think it was $5.24, $9.
$5.49.
$5.49
and $9 unit Botox if you get your lips done at the same time, which is really, really fair because lip filler is usually between $775 and $900. So we're really just giving you an introductory price so that you come in, you give us a try, and we know that you're going to love it and want to come back, but we're really doing it at a price that is letting you try it, and we're really not making money off it because we just know that you're going to love it when you see how it looks.
I think we're doing $9 per unit. Like, our thing is, like, we're all about trust. So our trust factor is try the best. When you're happy, you're comfortable, then, this is a special for you to build a relationship with us so you can see what you're getting is the best treatment.
Absolutely.
And that's why we're offering it. Not because we're trying to lessen or cheapen our prices, but because everybody likes to test their orders before they jump in.
And we understand people all have their injectors that they use, so we want to give them a reason to come and try us, and we're pretty confident that they're going to try us and really be comfortable and like us. So it's a long-term relationship building thing that we're doing.
Yeah, and also, people have to feel comfortable with you guys to be able to do these things. Especially like, would you consider this like cosmetic type of what's like the category for it?
So it's both cosmetic and also to, like I said before, to treat TMJ pain. But mainly it's used for cosmetic work.
Plus, it's perfect timing, guys. So you come in for your cleaning every 6 months. Some people come in every 3 months if you have dental issues. So why not get your Botox and filler at the same time? You have to usually time your lip filler around your dental cleanings and your dental procedures. So we could do it for you, right after your procedure. You don't have to worry about getting it done by a different doctor and having them mess around with your lip filler while they're cleaning your teeth. We already know what you've had done, and you're setting it at the perfect timing. There's no reason to go to two places.
Also, to circle back to the medical factor, just throwing it out there for people with migraines, TMJ.
Yes.
We just treated some guy for excessive sweating.
Oh, yeah.
Underneath his armpits. We do it all. If it's a medical issue, it is. It's not about insurance. It's about we could treat it and alleviate people's pain, and it fixes you. And they come in, they're not clenching, they're not grinding, they're not sweating. And you know what? They don't have migraines. So for me, it could also be used as medical purposes too.
Yeah.
And Dr. Gamza is a certified medical doctor. So you're not going to some spa where like some lady has like half a degree. He doesn't know where she's, setting it up. He could treat places. He knows all the trigeminal nerves, everything that's going on. So,
Anatomy of the face, and yeah.
And what are your thoughts, maybe like, you guys could speak to as far as like maybe the mental health side of things on how people feel before they go see you, and then maybe after? Do you feel like a lot of these things that you're helping people with, maybe that it's like adversity for them, or they're uncomfortable with it? Because then I know with you guys, like everyone's like super comfortable with being transparent with you guys and all that.
All right, so I'm going to tell you guys a little secret that he doesn't really tell many people, but Dr. G actually had a minor in psychology, or psychiatry actually.
Psychology.
So he actually knows a lot more about how to handle nervous people than most dentists would, which I think is a huge thing. He doesn't really tell people much, but it's something that's stuck in my brain that
It's half mental
told me.
things, man. Half
It's
mental
amazing.
things.
I think I think society in general focuses a lot on being youthful. I think a lot of people nowadays feel they want to look young. They feel self-conscious about that. They have insecurities about it. And I think when they get Botox and fillers, that builds their self-confidence, and in turn also builds their self-esteem and makes them feel good about themselves. And I think that helps with depression and anxiety. So I think there's a
It really does.
big correlation there.
It really does. I mean, I'm 82. Look how good I look.
Let's look at the world we live in. The world we live in is very, people don't want to age anymore. It's not a bad thing. I mean, it's part of like, look at our grandmas versus us. I mean, by 45, you look like you were 65, you had 20 kids, you look half. Today, 45 is just like starting your life.
Right.
Yeah? So I think it is a mental addiction, like you feel good. You feel like you're forever young, and that keeps you motivated in your work environment.
And this is a type of procedure that is completely safe. So, there's...
Sure about that.
Huh? Am I sure? Yeah. It's completely safe. Very easy, non-painful. People often are nervous coming in if they think it's going to hurt, but it really doesn't hurt at all.
Yeah.
Let's ask Simone what everybody said about Dr. Gamza with his hands.
Oh, you can't even tell his hands are in your mouth. He is so gentle.
It's art. It's friggin' art.
He's excellent. He really.
I don't pay them to say that. But
No,
thank
it's
you.
the truth.
I don't have to. I'm not getting
I don't
paid
pay
for this podcast.
He's absolutely excellent. When you might think I'm crazy, but when Dr. G does my teeth, I don't even get numbed for it. He's that
You
gentle.
don't know he's touching you. I mean,
He's excellent.
he like shot me up. I was like, "That's it." He's like, It might hurt. It might." And I'm like, "You're done." Like honestly, hands of like an angel. Seriously.
Thank you. I appreciate that.
Also,
Beyond.
people have been doing this for a long time, and I feel like now because of social media and more places doing it, that now you hear about it more. But speak on how it's been done for a while, and people have been doing it, right?
Okay, so I've been doing it since I've been working for plastic surgeons and other aesthetic doctors since I'm 22 years old. So I've been doing this now for almost 20-something years.
Wait, so I have a question. Because you're like a killer, you mastered it, you love it, you have a passion of your job.
Yeah.
What made you pick this market? I mean,
I kind of did it. It's kind of weird. I really didn't know what I wanted to do. I went to college. And
like most of us.
I picked to do something, and I went to school to be a medical assistant. And my first job out of that was working for a plastic surgeon, and I just loved it right away. And that was it.
That was it.
Yeah.
I think like a lot of us don't know until we go to college what we're going to be good at or what we think we're going to like, and then you find your market, and that's what you want to, like, we're happy doing our job. All of us at this table love what we do.
Yeah.
We come in every day, and I never would say, well, do anything else but be in a dental field. I mean, a hygienist by trade, a manager now by choice, and I love it. Like,
Yeah.
I never come in and I'm never, like, bored. So.
Because at the end of the day, you all are helping people
Of course.
in everything that you do.
And we love it.
It makes our jobs much more enjoyable. Honestly, it feels really good when a patient tells us that they're happy, they love the work. That makes us feel amazing.
Yeah, no, it's great, and we want people to leave happy. Well, sometimes, take a loss and lose money just because somebody is not happy and they need a touch-up. We want people to leave happy.
Yeah, that's the bottom line. Is always we want our patients to be completely happy with everything.
What are some misconceptions that you feel like people are unsure about, things that maybe they don't know about, like Botox overall and fillers?
That's a good
So, the word Botox comes from botulism, and it's a very toxic material, but that's in a very, very large dose. The Botox we use is a very minimal dosage. It is completely safe. Completely safe. There's no repercussions, no medical side effects to having Botox. I think a lot of people are concerned about that, but it's completely safe.
Yep. And we're open to stuff. Like, we can pretty much do it all. There's very little that we don't know how to do
It was
with
like
it.
from the 40s.
Yeah.
I mean, I don't know if anybody considers that still a disease, but I'm just throwing it out there.
And also, everything is like people are concerned if it's too much, if it's gonna drop my eyebrows. But we have mechanisms to fix that right away.
But everything pretty much is fixable as long as you know what you're doing. Yep.
She's a phenomenal artist who can mark anything, has been doing it for 20 years.
Yeah, Simone has a very good eye.
She knows exactly the eye. If somebody says not too much, she can nail it. That's
Right.
art. You understand? Like, I mean, listen, women in their 40s, including myself, a little tweak here and there, so what? Who cares? I feel good about it. She always makes it look like that's it, curtain.
Yep.
And she just is like, all right, let's do a little here. And then he has such gentle hands. He jumps in, and it's like honestly, it's like Mozart.
Wow, that's a big
No,
compliment.
there's
Thank you.
when you know what you're doing, there's very little that can be done wrong that can't be reversed. So we're very relaxed about it because we know that if you stay in the right areas
Yes.
and you do minimal amounts, that if somebody's brow drops a little too much, you can always raise it back up. We're very careful at the first few visits to make sure that we know your face and exactly how you react to the toxin, and that it's always reversible. We're never in an area that you can't reverse and you have some sort of injection that could drop your lid or do something major that you never want to do it again. We'll rather be careful and have you come back for a touch-up and be happy.
That is something I kind of want to get into. I want to ask, has there ever been times when you see someone who's just going a little too overboard and you have to maybe they want to do too much?
Yes.
Do you ever say,
Yes.
I'm not going to do this?
Often.
All the time. All the time.
I'm curious.
Sometimes
Talk
you
about
gotta-
that.
Sometimes you got to do. Sometimes what a patient wants is not always in their best interest.
Sometimes the patient thinks they want something that they don't actually want.
Exactly. So you have to be honest and tell the patient. I tell them all the time, even if it's costs more, I tell them I don't think it's a good idea. I want to do what's best for them, and I'll try to convince them to slow down. Let's do not too much,
Yep.
So
Yeah, we've noticed some people.
That happens often, you would say? Or?
We have people come in that think they need, we'll start them at 1 or 2 syringes of filler, and we have them come back slowly. They're just getting to know us. We want them to be comfortable with us. We have no problem. They're doing little touch-ups. We'd rather do too little than too much. We're not going anywhere. We're always here.
That's right.
They can always come back.
100%.
Honestly, to tell you the truth, this is the way I view it, Joe. We're all about love. Seriously, I tell Simone and Dr. Gonzo all the time, you could feel the warmth when you come in our place. It's not about upselling for us. This isn't our main market. This is an adjunctive service that we want to help.
Yep.
Right.
Yep.
Right?
Yep.
And we're here to give everybody every option to make their life easier. But we all do it for the concern of the patient and what they express to us.
And we've seen
So-
some disasters. We've had a couple people that we've had to fix up their brows. We've had to, get spot brows down, but we do it very slowly. And
Listen, nothing's perfect. But I will say, our goal is to make you happy at any cost. So even if we have to eat some product or whatever, we'll make it happen. So that's what I want to convey, and that's genuine. So I always say, give us a chance, because you know what? You want a young doctor doing it. You want somebody who has experience, who's young like Simone. You want somebody to hear your concerns. And you know what? No better time than now in 2024. Everyone's doing it.
we got you.
Very well
Come in
said.
and visit us.
Well said, Jen.
That's it? All right. Simone tapped out. That's it. Right? She's like, cut.
I've been doing it slowly a couple times.
But all right. Yeah, now you're.
It's going.
Yeah, I'm not editing. It's all right. They're going to eat with us. Yes, but nah, this was a great conversation. Thank you, Dr. G, for
My pleasure. My pleasure.
having us again.
And thank you, Joe, again for doing this. This is
No problem.
This is great.